Well, hey guys, about 2 weeks ago, I did a video all about everything you need to know about azelaic acid, what to expect, and y'all did such a great job leaving your comments and questions that I thought I would do a follow-up part 2 answering some of the most frequently asked questions that I saw. Now, as a quick reminder, azelaic acid is a prescription medication used to treat acne, rosacea, melasma, hyperpigmentation. It's also used to treat perioral dermatitis. You can also find it as a cosmetic ingredient at a weaker strength in various and sundry cosmetic products. Is azelaic acid good for improving small pitted scars? Short answer is no. Azelaic acid is a mild exfoliant, so it can smooth the skin surface and help in fading post-acne marks. But if you have a scar that is depressed, meaning not flat to the surface, that means that there's something down deeper that needs to be addressed, and azelaic acid doesn't affect change in the deeper layers of the skin. Medications that might improve pitted scars would be topical tretinoin, but usually it's going to be procedures to improve those types of scars. I have a video, as a side note, on TCA Cross for pitted scars, and I also have videos on acne scars that go into detail as to the different types of procedures to address pitted scars. Those videos go into detail as to the different types of procedures that address depressed scars. So check that one out, but in short, no, azelaic acid is not going to do anything necessarily for pitted scars. Is it possible to have melasma on the chest and neck? And if so, would azelaic acid help? It certainly is possible to have melasma on the neck and chest. That does in fact happen. There's also a variety of other conditions of hyperpigmentation that can occur on the chest and neck. There's this condition known as Ryle's melanosis, or a pigmented contact dermatitis that can appear on the sides of the neck and the upper chest. Kind of looks like melasma. It's thought to be a photodermatitis, basically the result of maybe prolonged exposure to a cosmetic that's been there, that's irritating, interacting with the sun, leading to this pattern of hyperpigmentation. For example, a lot of people who spray perfume on their neck, was always thought that that might be a trigger for this type of thing. So for that reason, I always suggest that if you are a fan of wearing perfume, don't spray it on your neck, spray it like on your waistband, where it's protected out of the sun, because the oils in perfumes, they can interact with sunlight, be very irritating, and potentially trigger hyperpigmentation. Now, all that being said, yes, absolutely, azelaic acid can definitely be helpful in these situations, because azelaic acid targets the enzyme tyrosinase to help with lightening hyperpigmentation. And it doesn't necessarily matter if it's melasma or if it is hyperpigmentation from prior inflammation or post-inflammatory hyperpigmentation. Azelaic acid can be beneficial. Now, is it going to be sufficient enough on its own? Probably not. As is the case with melasma on the face, generally speaking, when it comes to targeting hyperpigmentation, you really need a multimodal approach. Rarely is it enough to just get away with a single ingredient. But azelaic acid definitely can be a beneficial player in fading hyperpigmentation on the neck and chest, provided you tolerate it. As I said in that video, azelaic acid is generally pretty well tolerated, although it is drying and it can be irritating. Some people find it burns and stings. When we're talking about the skin on the neck is a lot more delicate, so you may be more prone to dryness and irritation from azelaic acid in that area. But all that to say, it definitely can be used there and can be beneficial for hyperpigmentation in that area. Can you recommend a good moisturizer to help with the dryness and irritation from azelaic acid? So as I pointed out in that video, while azelaic acid is pretty well tolerated, it can be pretty drying. And a lot of people find that it stings, elicits symptoms of itch. And one way to minimize that is to make sure that you're moisturizing the skin. Now, there are so many moisturizers out there on the market, tons and tons of facial moisturizers. And by and large, there's not a wrong choice. If you find a moisturizer you like and is working for you, there's no need to abandon ship per se. But moisturizers that have ingredients in them that are beneficial for both acne, rosacea, and hyperpigmentation, all three of which are things that azelaic acid is frequently indicated for, I often like to lean into moisturizers that have niacinamide, provided you tolerate it. Niacinamide is anti-inflammatory, it has anti-redness properties, it's helpful for oily acne-prone skin, and it's also helpful for hyperpigmentation. It's an antioxidant. Another ingredient is licorice root. Licorice root is very calming, helps with barrier function, soothing, reducing inflammation. One moisturizer I'm rather a fan of is the ProCure Rosacare. I like it because it has a little green tint to it that can help offer some cosmetic color correction to persistent facial redness. So that's a great option. It's very lightweight, but yet deeply hydrating. So if you're somebody who feels that heavy moisturizers make you feel overheated, and if you have rosacea, that precipitates a flush of facial redness, I happen to think that's a really good option. The other one that's a really good option is the Aveeno Calm and Restore Redness Relief Facial Moisturizer. It's a bit thicker in consistency in comparison to the ProCure Rosacare one, so if you want something a bit more moisturizing, especially to address the dryness issue, that's a great option. It has feverfew extract in it, which is anti-inflammatory, and it has, of course, oat, which is a wonderful anti-inflammatory ingredient in moisturizers and also is hydrating, soothing. And then, of course, there's the CeraVe facial moisturizer, either their AM moisturizer with sunscreen or their PM moisturizer without sunscreen. Both of those are great options. They're very hydrating, yet lightweight enough to not make you feel overheated and potentially aggravate a flush. If you aren't aware, YouTube has this new shopping feature. There should be a little shopping bag in your lower corner of the screen. If you tap on that, I will put these things in there so you can read more about them. I have cystic acne being treated with azelaic acid, topical isotretinoin, and erythromycin gel. Do I need to cleanse my face twice a day, or is it sufficient to wash my face just once a day in the evening? It's fine to just wash your face once a day at the end of the day if that's what you like. Some people who have an oilier skin type find that they prefer to wash their face twice a day, and in the case of acne, that may help in minimizing the frequency of breakouts, because a big part of acne is excessive oiliness. That oil on the surface of the skin can break down and trigger more breakouts. So some people who have very oily skin find that they really need to cleanse twice a day, whereas other people, once a day is enough. And in fact, for many people, once a day is more than enough, and cleansing too frequently makes their skin more sensitive, dries out the skin. To be clear, if you're using this regimen that you've outlined at nighttime, the following morning, you don't need to wash the actives off. That's a common misconception. You don't need to wash them off. If you're someone who just likes to wash your face in the evening and you don't find the need to wash again in the morning, you're more than fine to do that. You don't need to wash the actives off. As a side note, here in the US, topical isotretinoin, we don't use it frequently at all to manage acne, but in other countries y'all do, and I have a recent video comparing it to topical tretinoin, so definitely check that out if you're someone who is using topical isotretinoin and want to learn more about it. We go into the details in that video. What is the best budget-friendly cosmetic azelaic acid? This person specifically mentioned that they love the Paula's Choice azelaic acid that I mentioned in that video, but it is a bit expensive. Is there something more budget friendly? Absolutely. So azelaic acid, as I mentioned in the beginning of the video, it's a prescription medication, but you can also find it in weaker strengths in various and sundry cosmetic products. Now, to be clear, the efficacy of azelaic acid in a cosmetic is not well researched, because the research that we have is looking at the prescription strength azelaic acid. That's not to say that the cosmetic ingredients are not helpful or a waste of time. Some people really do find that they're beneficial for acne, hyperpigmentation, redness, overall skin tone. As I mentioned in the last video, azelaic acid also, a lot of people find that their skin is less oily, less greasy when they use it. So those are all great things that a lot of people appreciate with just the weaker strength cosmetic stuff. That being said, because these are cosmetics and not the medication version, you really can't say for sure that any one is the best, because we don't have studies to actually prove that. Objectively speaking, you can't actually say this is the best, this is the best. But all that aside, the ordinary 10% azelaic acid suspension, I think it's about $11 for a 30 ml tube, and that's a great option. How does azelaic acid interact with fermented ingredients such as bifida and galactomyces? Fermented ingredients in skincare, they're really popular. Brands will make a lot of claims, which some of them have some research to back them up. Things like, well, these ingredients help with moisture, they help improve skin elasticity, they help brighten the skin, they have antioxidants, all of these things. But long story short, when it comes to fermented ingredients, there's really an overall lack of high quality research. And it's actually a pretty broad category of different ingredients. And the ingredients vary quite a bit in terms of the constitution, because a fermented ingredient is basically the ingredient, bacteria or yeast ferment the ingredient, and that process is not going to yield identical results every time. Different bacteria, different yeast may have different compounds, different initial starting materials. For example, soy ferment actually may be more beneficial than just soy as an ingredient, because the fermentation process can enrich for the active forms of certain antioxidants. But again, more research is needed. So is it okay to use azelaic acid alongside fermented ingredients? Presumably, but we don't have any research actually looking at that. I don't see any reason why it wouldn't. Azelaic acid is already naturally present on your skin. There's nothing about azelaic acid that should counteract whatever potential beneficial properties are in the ferment. That being said, fermented ingredients, they can improve moisture content because they do have humectants in them, and they may, because of that, enhance penetration of azelaic acid. So they may make it so that either it's more effective because it's easier for it to get in, or they may make it so that it's just too irritating for you, especially in the beginning. And I can't predict that for any one person. It's going to vary from person to person. But I see no reason why the two should not be used together, provided you tolerate them. Is azelaic acid safe for people to use if they have vitiligo? Yes, azelaic acid, it inhibits the enzyme tyrosinase, and that's how it works to treat hyperpigmentation. But it doesn't affect the pigment of your normal skin. Now with vitiligo, on the other hand, you get complete loss of pigment because your immune system attacks the pigment cells, the melanocytes. Topical azelaic acid should not influence that whatsoever, but there's no research actually looking at azelaic acid in vitiligo, but there's no reason to suspect that. Say, for example, you have vitiligo on your hands, acne on your face, you want to use azelaic acid to treat the acne on the face, shouldn't have any issue there. What about potassium azeloyl diglycinate? So this is a cosmetic ingredient that is basically azelaic acid that has undergone a reaction with glycine. So it has glycines attached to it, and that's thought to make it a more hydrating ingredient, possibly reducing dryness and irritation. Now this is a cosmetic ingredient, it's not a medication, so we don't have research showing how it works in comparison to azelaic acid. In theory, it's less drying. In theory, it's going to be accompanied with less irritation. But is it effective? Who knows? There are two studies that I'm aware of looking at potassium azeloyl diglycinate, one for rosacea and one for melasma, I believe. And they show improvement, but the problem is the product that they use in those studies also has other ingredients in it that could explain the improvement. So more research is needed. Not a bad ingredient, seems to be well tolerated. So all that to say, if you want to derive the benefit from azelaic acid from a cosmetic product, I would not suggest going with the potassium azeloyl diglycinate, simply because at least we have research on azelaic acid. We don't with PAD, as I like to call it. What about mixing azelaic acid and benzoyl peroxide? I assume you mean for acne, because both of those are acne treatments. Now, regardless, I never recommend mixing two separate things together and putting it on the skin, because doing this can mess up the formulations and mess up the distribution of the active ingredient on the skin surface. One formulation, you try and mix it, like say into your lotion, your cream, or you're trying to mix two different products together. They can be very incompatible. So I don't recommend doing that. Now that being said, can you apply benzoyl peroxide and apply azelaic acid one after the other? You can. Azelaic acid, as I pointed out in the last video, it can be used alongside any ingredient, provided you tolerate the combination. Can azelaic acid be used with copper peptides? Presumably. We don't really have good research on copper peptides in the setting of using azelaic acid, but presumably they can. There's no reason to assume that they can't. As I said, azelaic acid can be used alongside any ingredient, provided that you tolerate the combination. It's not going to render the copper peptides ineffective, degrade them, or it shouldn't. I mean, but again, we don't have research on this type of thing to say how that impacts results, but in theory it should be just fine. Can azelaic acid help with keratosis pilaris? That's a great question, because it might actually be very helpful for keratosis pilaris, or it may aggravate it. So keratosis pilaris is a dry skin condition where you have kind of a problem with the skin cells not turning over efficiently around the hair follicle, around your pore. So you get a buildup of dry, rough skin, and that can end up, that's basically a little focal area of a skin barrier issue. And not only is it rough and dry, but you can develop background redness. So azelaic acid is a very gentle exfoliant, so it can help soften and exfoliate the built-up dried stuff, and it can also help with the redness. But in the beginning especially, some people find that azelaic acid is too drying. So if it's too drying, then it may actually end up worsening the keratosis pilaris. A lot of people have keratosis pilaris on the face that is red, and azelaic acid is a good option to trial in a lot of those patients. If you are using azelaic acid in the morning, can you still use your vitamin C? Absolutely. Vitamin C is popularly utilized in the morning with the idea that, it's an antioxidant. So it should, in theory, provided that it works and everything, it should get into your skin and help combat the oxidative stress that occurs upon exposure to all the environmental stressors that you are exposed to throughout the day. Y'all know from my videos, vitamin C, specifically ascorbic acid, it's a tricky ingredient. It's not very stable, and its penetration into the skin is limited. But that being said, there's no reason for you to worry about using it and then applying azelaic acid on over it. By and large, it's a good idea, if you're going to use a vitamin C serum in the morning, to put it as the first step in your morning skincare routine to really help maximize penetration, since penetration is such an issue with it. And you can let it absorb. It shouldn't take you very long. It shouldn't take very long for it to absorb, and then you can apply azelaic acid on over it. Now, if you're using prescription azelaic acid, whether it be the cream or the gel, depending on the vitamin C that you're using, you might end up getting some pilling. So a way around that is to make sure you're not using too much of either product. That's really where you can get pilling, is like if you have a gel and a cream and you put on either too much, or sometimes just gel and cream don't vibe well together. So that can be an issue with formulation. Would azelaic acid be useful to use in the groin or underarm area for hidradenitis suppurativa? It can be, and the idea being azelaic acid is antimicrobial. With hidradenitis suppurativa, you have these recurrent painful boils that come together and make these sinus tracts. And that area of the skin can become colonized with bacteria that further flare the disease. So antimicrobials like benzoyl peroxide, chlorhexidine, which is sold under the brand name of Hibiclens, can be utilized to help cut down on that bacteria. And likewise, azelaic acid can be helpful. The issue with hidradenitis suppurativa, unfortunately, and why these topical antimicrobials sometimes are of limited benefit, is that the bacteria can actually form pretty tenacious biofilms, especially within the sinus tract. And so much so that sometimes the topical antimicrobial stuff is not as effective. I got some questions about moisturizing with azelaic acid. Should you put your moisturizer on first and then azelaic acid? Should you put your moisturizer on after azelaic acid? Or should you do this sandwich technique where you put moisturizer on, then azelaic acid, then moisturizer? There's really no wrong answer here. You can do whatever works best for you. If you're someone who finds that azelaic acid burns and stings, I suggest putting moisturizer on first. That can help cut down on the sensation of burning and stinging, help you tolerate it better. And if you find that it's too drying, even doing that, you may do the sandwich technique. Or you may want to enhance penetration, especially if you're someone who has like acne, you've got a lot of cystic pimples, and the cystic acne, the skin is thick, so you really want to maximize penetration. You may find that it's in your best interest to just apply it straight on there, let it absorb, and then apply moisturizer on over to cut down on dryness and irritation for you. That may help you with the penetration. Can azelaic acid help with dark circles? Unfortunately, no. Dark under eye circles, they're either hereditary in most cases, or they're part of the natural aging process. With age, you get redistribution of fat pockets, you get resorption of bone, so the eye socket actually widens, but everything around it kind of sags down a bit, and then you get descent of the cheek, pulling down that tear trough, and through light scattering, you have more prominent dark under eye circles, hollows. Azelaic acid is not going to address that. Azelaic acid helps with hyperpigmentation, but it's not going to address like the anatomical changes around the eye. Now, if you have post-inflammatory hyperpigmentation under the eye, then azelaic acid may actually help. Someone asked, how does 15% azelaic acid compare to 20% azelaic acid? Now, these are both the prescription strengths. 15% azelaic acid, it's the gel. It penetrates the skin better than the 20% azelaic acid cream. You get about 8% azelaic acid penetration in the gel, and you get about 3% azelaic acid penetration with the cream. How about using azelaic acid with Differin in your evening routine? Absolutely, you can do this. Again, you can use azelaic acid alongside any ingredient provided you tolerate the combination. Now, what order should you apply these? It really doesn't matter. You could do azelaic acid first and then adapalene, or vice versa. Again, you may run into some issues with pilling depending on the vehicles that you are using. So this combination can be effective for acne for sure. And it's best if you're using it to treat the entire face, sparing, of course, the eyelid area and the mouth, because adapalene can be too irritating in those areas. It's best to use it that way because not only is it going to help address active breakouts, but by using either ingredient or the ingredients together this way, it helps to control and prevent future breakouts, as opposed to using either ingredient as a spot treatment. Neither azelaic acid nor adapalene, they're not really spot treatments, meaning if you suddenly get a pimple, reaching for either of these and trying to get it to go away overnight with either ingredient or the combination, it's not going to cut it. It needs to be consistently present in your skin, and ideally to the entire face, sparing the eyelids and around the mouth and like this part of the nose here, just because those ingredients can be too irritating there. But yeah, it's best that way and staying consistent with it. Does azelaic acid kill demodex? It might. So demodex mites are naturally present on everyone's skin, but with rosacea, which azelaic acid is a treatment for, with rosacea, people who have rosacea, they have a lot more demodex on their skin, like 4-fold greater burden of demodex. And it's thought that these mites, they contribute to the immune dysregulation in the skin with rosacea. So much so that there is a anti-mite medication that is used to treat rosacea. It's called ivermectin, sold under the brand name Soolantra. I have a video all about that as a side note. But azelaic acid might also help cut down on the burden of demodex mites in people who have rosacea. It's a mild exfoliant, so that may be part of how it could help in that regard. And it also has antimicrobial activity, so it may help. There's a lot of active ongoing research actually looking at azelaic acid's effect on demodex mites. All right, y'all, those were some really fantastic questions that you left on my video. I greatly appreciate it that you guys leave your comments, your questions, and I really hope this video was informative to you. Now, if you missed that video, it's gonna be linked on the end slate, so you can watch it next. That way you are all caught up on the wonders of azelaic acid and how it's utilized. But if you guys enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.